Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 29th lecture on systemic pathology. Today, day 7 of diseases of respiratory system. Day 7 of diseases of respiratory system. Dear audience, today's topic is pneumoconiosis. Today's topic is pneumoconiosis. First come to what is pneumoconiosis. It is an interstitial disease of lung caused by any type of aerosol. So, an interstitial disease of lung caused by any type of aerosol is known as pneumoconiosis. It is an interstitial disease of lung. Cause of such type of interstitial disease of lung is inhalation of any type of aerosol. Dear audience, pneumoconiosis was considered as occupational disease. It was considered as occupational disease, but nowadays it is considered as environmental disease. Nowadays it is considered as environmental disease. Why nowadays it is considered as environmental disease? Because pneumoconiosis is seen among general populations in urban area and in industrial area. Why considered as environmental disease? Why it is considered as environmental disease? It is considered as environmental disease because it is seen among general populations in urban area and also in industrial area. As nowadays such type of interstitial disease, that is pneumoconiosis, is seen among general populations in urban area and in industrial area, so it is considered as environmental disease, not as occupational disease. Now come to types of pneumoconiosis. Coal worker pneumoconiosis, silicosis. Such type of pneumoconiosis is caused by silica. asbestosis. Such type of pneumoconiosis is caused by asbestos, caused by asbestos. Siderosis. Such type of pneumoconiosis is caused by iron dust, caused by iron dust. Stenosis. Such type of pneumoconiosis is caused by dust of tin, caused by dust of tin. Dear audience, these are different types of pneumoconiosis: coal tar pneumoconiosis, silicosis, asbestosis, siderosis, stenosis. Dear audience, now come to certain factors upon which development of pneumoconiosis depends. Factors upon which development of pneumoconiosis depends. What are the factors upon which development of pneumoconiosis depends? Dear audience, the factors upon which the development of such type of interstitial lung disease, that is pneumoconiosis, depends are amount of aerosol, that is amount of dust present in airway of lung. Amount of aerosol, amount of dust present in airway of lung. Greater the amount, more chance of pneumoconiosis. Smaller the amount, less chance of pneumoconiosis. Dear audience, suppose this is the airway of lung. If there is greater amount of aerosol in the airways, more chance of development of pneumoconiosis. Size and shape of dust. Development of pneumoconiosis also depends upon size and shape of dust. Diameter of dust less than 1 micron remain suspended in airway and it is exhaled. As diameter of dust less than 1 micron remains suspended in airway and is exhaled, so presence of dust with diameter less than 1 micron does not cause any pneumoconiosis. Dear audience, if this is the airway, and if this is the dust of less than 1 micron diameter, it will suspend in the air of the airways and it will be exhaled. So there will be no pneumoconiosis. But diameter of dust from 1 to 5 micron settles in airway. Again, if the diameter of the dust is 1 micron to 5 micron, that dust will settle in the airways and it will lead to pneumoconiosis. Leads to pneumoconiosis. Dear audience, again, if the size of diameter is less than 1 micron, usually there will be no pneumoconiosis because it will suspend in the airway and it will be exhaled. If the diameter of dust is 1 to 5 micron, it will settle on the airway and it will not be exhaled and it will lead to pneumoconiosis. Solubility of dust and reactivity of host. If the dust is soluble in the airways and if there is sufficient reactivity of host, there will be no development of pneumoconiosis. Effect of cigarette smoke. Dear audience, cigarette smoke may enhance the development of pneumoconiosis. So, these are the factors upon which development of pneumoconiosis depends. One is amount of aerosol present in the airway. Smaller the amount, less chance of development of pneumoconiosis. Greater the amount, more chance of pneumoconiosis. Size and shape of dust. If the diameter less than 1 micron, less chance. If diameter 1 to 5 micron, more chance. Solubility of the dust and reactivity of the host. If the dust is soluble in the airways and if there is sufficient reactivity of the host, there will be no development of pneumoconiosis. Effect of cigarette smoke. Cigarette smoke may enhance the development of pneumoconiosis. Dear audience, we are talking about pneumoconiosis and interstitial lung disease. Now come to pathogenesis of pneumoconiosis. Dear audience, suppose this is the airway. And these are the alveoli. You know, within the alveoli there is alveolar macrophage. These are alveolar macrophages. If these are the aerosol or dust, alveolar macrophage engulf the aerosol, and after engulfing the aerosol, the macrophage is known as aerosol laden or dust laden macrophage. Formation of dust laden macrophage. These are the dust laden macrophage. Dust laden macrophage secretes leukotriene B4 also secretes fibroblast growth factor, fibroblast growth factors. Again, inhaled dust or aerosol is engulfed by alveolar macrophage, and after engulfing the dust or aerosol by the alveolar macrophage, formation of dust laden macrophage. These dust laden macrophage secretes leukotriene B4 fibroblast growth factors. Dear audience, you know leukotriene B4 is a potent chemotoxic agent for neutrophil. Leukotriene B4 potent chemotoxic agent for neutrophil, and this leukotriene B4 recruits neutrophil in the alveoli. Leukotriene B4 recruits neutrophil in alveoli, and this recruited neutrophil liberates proteolytic enzymes and toxic free radicals. These proteolytic enzyme and toxic free radicals liberated from the recruited neutrophil causes injury of lung. Proteolytic enzymes and toxic free radicals causes injury of lung. Fibroblast growth factor secreted from dust laden macrophage acts upon fibroblast and synthesis of collagen fiber. And this collagen fiber is associated with formation of nodules. And this nodule is the pneumoconiosis, is interstitial lung disease. So, this is the nodule formed by collagen fiber is pneumoconiosis. Again, inhaled dust is engulfed by alveolar macrophage, formation of dust laden macrophage, secretion of leukotriene B4 and fibroblast growth factor by the dust laden macrophage. Leukotriene B4 recruits neutrophil, and neutrophils liberates proteolytic enzyme and toxic free radical that causes lung injury. Fibroblast growth factor secreted from the dust laden macrophage acts upon fibroblast, synthesis of collagen, and that collagen forms nodule. This nodule is nothing but the pneumoconiosis, an interstitial lung disease. Dear audience, if anybody suffers from pneumoconiosis, what may be the clinical presentation? Dear audience, pneumoconiosis is an interstitial lung disease. Due to formation of nodules, there is decreased compliance of lung. decreased compliance of lung. Due to decreased compliance of lung, patient suffers from dyspnea on exertion. Dyspnea on exertion. So, dyspnea on exertion is the presentation of patient suffering from such type of interstitial lung disease, pneumoconiosis. Now come to laboratory diagnosis of pneumoconiosis. X-ray chest, fine needle aspiration cytopathology FNAC, biopsy and histopathology. X-ray chest reveals opacity. Suppose this is lung, X-ray chest reveals opacity. FNAC, fine needle aspiration cytopathology, reveals dust laden macrophage and collagen fiber. If we do FNAC, CT guided FNAC, we will get dust laden macrophage, this is dust laden macrophage. In addition to dust laden macrophage, we will get collagen fiber. Biopsy and histopathology reveals area of fibrosis along with area of fibrosis dust laden macrophages. Dust laden macrophages. This is the area of fibrosis. Along with there is dust laden macrophages. This is the histopathological findings of pneumoconiosis. Dear audience, today I have discussed about the pneumoconiosis briefly. It is an interstitial disease of lung caused by inhalation of aerosol or dust. It was considered as occupational disease, but as it is seen in general populations, in urban area and in industrial area, nowadays it is considered as environmental disease. There are different types of pneumoconiosis: coloworker pneumoconiosis, asbestosis, stenosis, siderosis. There are some factors associated with the development of pneumoconiosis. Amount of dust present in the airway, greater the amount, more chance of development of pneumoconiosis. Size and shape of dust, the diameter of dust 1 to 5 micron settle in the airway and causes pneumoconiosis. Less than 1 micron size, less chance of pneumoconiosis. It depends upon the solubility and reactivity of the host, also on the effects of cigarette smoke. Alveolar macrophages engulf with dust and become dust laden macrophage. It secretes Leukotriene B4 chemotactic agent for neutrophil and fibroblast growth factors. Leukotriene B4 recruits neutrophil and that neutrophil secretes proteolytic enzymes and toxic free radicals. That enzyme and free radicals causes lung injury, and the fibroblast growth factor acts upon the fibroblast and causes synthesis of collagen fiber, and that collagen fiber makes nodule, and this nodule is the interstitial lung disease, that is pneumoconiosis. Patient who suffers from pneumoconiosis, the compliance of lung of that patient is decreased, so patient suffers from dyspnea on exertion. If we do X-ray test, we get opacity. If we do fine needle aspiration CT pathology, we get dust laden macrophage and collagen fiber. If we do histopathology, we get area of fibrosis with dust laden macrophage. Dear audience, today up to this. Thanks all.